what is striking to me is the scale of the diabetes problem that they have over here. We did a trip out to the central markets at Honiara, and what was evident there was the cost of the fruit and vegetables and fresh fish. It probably costs 3 or 4 times what we would pay for the same produce in Australia, and you can see quite clearly why average Solomon Islander would resort to the much cheaper mass-produced imported rice and tinned fish. This, combined with I think their obvious sedentary lifestyle, has led to much of the diabetes and obesity epidemic. I think it seems like a very simple problem, but I think that the solution is actually very, very complicated. The message here, I think, is to start small in what we can do for Honiara and the National Referral Hospital. I think we can develop protocols for better insulin management for the staff and including the nurses, getting them involved more. I think they need identification and training of specific doctors who are interested in diabetes and endocrinology there, which clearly doesn't exist. They only have vials of insulin which patients need to draw up in syringes. There's no access to the easy ways of managing insulin with the pen devices we have readily available to us. And I think this could be a fairly easy hurdle to overcome with the right support and resources going across to the Solomon Islands for them.
Most of our funding goes to the referral hospital, and that's why all the provincial hospitals were all missing out. Even in the primary health care, in the clinics in rural areas, they don't have enough medication. So we have to improve the primary health care. That means building up more clinics, training up more nurses in the tertiary health care and the National Referral Hospital. We need more equipment.
I went to Gizo to conduct some cardiology clinics. I went with Oliver Archer, who's an echo technician. Gizo is an hour and a half's flight from Honiara and home to around 50,000 people spread over a few hundred islands. In the hospital there we conducted clinics for 2 days and saw 80 patients over that time frame. The majority of those had echocardiograms. The specific needs in that area of the Solomon Islands is medications, more equipment, a stress test machine and a functioning ECG would be very useful, and education for the staff on cardiology and management of cardiac problems is very important. There were very few protocols in place and the nurses often worked independently.
I think getting small steps saves lives over time, one little bit at a time. Is it from a visit? Is it from a little donation, like the treadmill donation that we saw today? That's going to make a huge, significant difference to us. It doesn't have to be something very big, you know. I think the program has saved so many people, and we appreciate what St. Vincent has given us, and also the many people who have contributed to that, not least people like yourself, Sir Trevor, Ian, and many, many more.
Before the operation, I can't walk, I can't run, and I can't climb upstairs or run up the hill or walk, but now I'm very happy because it was like a new life for me. When I go to St. Vincent Hospital, they treat me there, I was very happy and I'm glad. Now I can even go for an Olympic game and then running, swimming, jumping. It was like cool, it was like so much fun. So thank you so much, St. Vincent Hospital, for the very big help and support towards us. Thank you very much. Yeah.
Thank you. Hi, my name is Britas. I'm a Solomon Islander patient, heart patient, and before I got sick, I was very sick and difficult to do work, and after that I was really blessed to have St. Vincent take me to the hospital. So now I'm good. So I really thank you for St. Vincent Hospital. I've get my operation well done, and now I can do the activities that I available myself to do, like swimming, jumping, and now that's all for me. Thank you.
We are very happy. Yeah.